Aloha, good afternoon. Thank you for joining us today. I am your host, Tammy. I'm an HIT analyst with Hawaii Health Information Exchange. Today's webinar is very hands-on and informal, just how-tos and demos so you can better take advantage of the Community Health Record and Electronic Referrals Network. Many Hawaii doctors and staff who are using the Community Health Record and Electronic Referral System say it boosts efficiency, saves time and money, lowers your stress, and allows you to spend more time with patients. So let's take advantage of that. Please feel free to post a question at any time, and we will get to it as soon as the main presentation ends. Just type in the question in the text box below the hand icon. Let's get started. Today we're going to go over just a quick review of the Community Health Record and Referrals modules. These are just quick tips of what's going on in the community and ways to access the information. To start with, you're going to go to the Community Health Record page. As you can see, you have the ability to reset your own password here on the right-hand side. You will just need your username and the answers to your security questions. If for some reason you don't remember your username or you're having a struggle or challenge with resetting your password, you always have the ability to email our help desk or call. So to get started, we're going to type in your username and then your password. The first part we're going to go over is the Community Health Record. So as you know, when you first log in, you go right to the patient search. You can search by last name, MRN, Social Security number, or date of birth. In this case, I'm going to utilize a test patient whose name is ZZ Test. And then click search. So as you can see, I am not currently associated with that patient, but that's fine. That's going to happen to you from time to time, especially if you're getting a new referral or there's a new patient or and for some reason the patient did not affiliate themselves with you. All you would do is select your reason, and in this case, I'm going to choose IT support and development. However, in most of your scenarios, you're going to select I have established clinical relationship with this patient, or patient is new to my practice. And then you click Access Additional Records. What this is going to do is it's going to pull all the information that is related to that name. So normally, I would just see ZZ Test, BMW, because that's my traditional test patient. However, in this case, since I accessed additional records, I'm pulling anyone's name who has the letters ZZ Test. I'm going to look here at my patient name for ZZ Test, confirm it's my patient by the date of birth, the age, and if I'm looking for a specific facility, it is listed here. I'm going to click on it. It's going to take me to the patient summary page. The patient summary page is a landing page. It is exactly as it states as a summary. It is a quick synopsis of what's going on with the patient. All of these inserts are clickable, and they can take you to a different landing page. However, we are going to utilize the tabs on the left-hand side so we can drill down and get more information related to our patient. First tab we're going to select is Encounters. In Encounters, you need to scroll down as you will normally not find problems listed here at the top. So this is traditionally blank, so don't panic. Instead, just scroll down to the bottom, and under Encounter History, you are going to find inpatient and ambulatory information related to your patient. These are also clickable. And if you have or want the ability, you have the ability to click the face sheet. It's going to give you information specific to that encounter. So for example, this is going to give you demographics. This tells you that my patient is female, they're 41 years old, their date of birth, what took place at the summary, or what took place at the encounter. So as you can see here, my patient was admitted on 7/28. They were in room T827. They were seen by internal medicine. If the patient was ever discharged, the information would be here as well. You can see their care team, that's including the primary care, attending, and admitting doctors. Your allergies or anything that the patient has reported, it would be listed here. And it also includes procedures, emergency contact, your guarantor, and your insurance information. So if my test patient had insurance information, it would be listed here. In most cases, it can hold up to 3 different types of insurances. It'll tell you which is primary, secondary, and tertiary. Throughout this navigation, you still notice here at the top that the header has remained the same. This is a way to double check the fact that we are still on our patient of ZZ test. With this information, you have the ability to print or save as a PDF. If you save as a PDF and upload into your EMR and you have challenges, you can contact us directly, as we will make sure you have the Adobe PDF reader or writer. In order to print, you would just select the print icon, and then here's the information. To save it as a PDF, in most cases you can hit the print icon again. The destination, as you can see, my destination is currently the printer here in our office. I can change the destination to save as a PDF. And then I would hit save. And then I would save it wherever I needed to save it. In this case, I'm going to put it on my desktop. In order to go back to the patient summary, you click the blue arrow. And we're going to check out the next tab, which is Results. Results gives you the ability to have the most filters. So for example, if you would like to customize your information, you have the ability to do so. Under Results, you will find labs, radiology, transcriptions, pathology, cardiology, and the cath lab. You also have the ability to do a date search, so if you're looking for something specific, you have that ability. Also filters related to inpatient, outpatient, and the emergency room. In this case, we're selecting all, so you can see the different types of information that's under the Results tab. Please note that all the information that is provided is in a final status. So for example, if we were to look at a lab, you can see here the status is final, so we don't send you anything that's preliminary. Again, this is a standard CBC test. You can see the test that was completed. Anything that is out of range is in red. It's either high or low. It also gives you the facility in which it was taken, the date it was collected, the date it was received, and the status should always be final. The priority would either be R for routine or S for stat. Down here at the bottom, you also have the ability to see any type of verbiage as well as where the test was actually performed, in case you needed to call directly. Now here, the next thing is the pathology. The pathology is going to be a report. The radiology is just a report as well. By summer, we hope to have the actual images in there for you to review. So here, you have the ability to read the information that was provided by the radiologist and the doctor's findings. Again, you can save this as a PDF or upload it into your EMR or print. The most common item in which clients utilize the results inbox or the results tab for is discharge summaries and H&Ps. So we're going to click the discharge summary. And as you can see, this is an additional click, only for some hospitals. Some of our hospitals, such as Castle and Hilo, have the information submitted in directly as a face sheet. Here, through Queens Medical Center, they do it as an attachment. So you click the discharge summary, and it pulls it up as a PDF. Again, you have the ability to print or to save and upload. So you have to get back into your community health record by clicking the next tab, and we're going to go back to the results. The other thing to keep in mind is results is the data that's feeding in. So as you know, we have a variety of sources of data feeds. So this doesn't matter what type of insurance the patient has. It doesn't matter where they've gone, as long as they've gone to diagnostic or clinical related to labs. So it doesn't matter which one of those your office currently utilizes. It's the fact of whatever followed the patient. So if Dr. A only utilizes clinical, but Dr. B sent the patient to diagnostic, you still have the ability to log in as Dr. A and see the diagnostic information. As a reminder for some of our information that comes from sources, so you have our local hospitals feeding data in, such as Queens and HPH. You also have Hilo Medical Center, you have Molokai, you have Maui Memorial. So you have a wide variety of sources that are feeding data in. If you go to our website, you can see the map and the data feed information. The next tab we're going to utilize is medications. So the medication feature gives you the ability to check their allergies, so any allergies in which has been reported by the patient, and any type of medication alert. So if the patient was on some type of medication in which could cause a drug-to-drug interaction, it would report here. In most cases, we would do a query. The query here, unfortunately, does not link to my test patient, but what you would find is the medication and strength, the pharmacy, prescribed by, and the last fill. Please note that our last fill, that means that the patient has actually picked it up and is in their possession. This also goes for POB offices. And what I mean by that is so many times a doctor will write a prescription, the prescription will go to the pharmacist will fill it, and it sits on the shelf. This means if it shows up here in the community health record that the patient has physically picked up the medication. It's also a great tool if you have a chronic drug seeker. You can get the ability to see actually what was the last time they had a narcotic or who ordered it for them and what pharmacy they picked it up at. Again, you have the ability to filter here on the top right-hand side, and you have the ability to print. We're going to talk briefly about these two tabs here. First, we're going to go to Profile and Face Sheets. I touched briefly on the fact that there's demographic sheets affiliated with each patient. If you need that demographic information on a quick basis, you can just go right here and click Profile and Face Sheet. Again, it gives you the demographics, the emergency contact, and the insurance information. If you want a face sheet is going to give you more information specific to an event or an encounter that took place. As you can see under a demographic page, your front office staff may be the one to utilize this sheet the most. However, your face sheet is going to have more of your medical reason. So it has your visit summary, which is here, and your care team. So that's the difference between the two. So the difference between the two, again, is your face sheet will have a visit summary and a care team, and your demographic information is going to have more for your front office staff. If you needed to create a care summary or a CCD in order to meet your meaningful use or to share in transition of care, you can do so by pushing Create Care Summary. However, I recommend be very careful because what you're doing is you're pulling all the data from what is inside the community health record. So it could be up to hundreds of pages. You also have the ability, when you do create a care summary, to choose by MRN or Social Security. As you can see throughout this whole process, no matter which tab I landed on, this header here at the top stayed the same, showing our patient's name, gender in which they're born with, age, and date of birth. If you are an office that, such as a PCP, you may have, or a specialty, you would have something called a results inbox. The results inbox is going to give you the information related to your patient. So for example, if you are a PCP and your patient goes to give birth, there will be a notification in your results inbox stating that your patient has given birth. It's a face sheet like I showed you earlier. Here is your referrals, in which we're going to talk about in just a moment. This is going to show us how to actually work the referral and what's coming and going, as well as setting notifications. We're going to go back and find our patient again. We're going to go over how to send a referral. To start with, we're going to make sure there's no questions related to the community health record. Okay, so we have one. For the physician info in the code, they're NPIs. So do you have to put in your NPI? The only time your NPI is ever needed is in the registration process. No other time is an NPI needed. Okay, let's go on. If I didn't answer your question fully, just type another question and maybe specify exactly what you're wanting to know. All right, so let's move to referrals. To send a referral, you're going to click the last button here. You're going to find your patient, just like we did a moment ago. This step would normally be the same. However, since I moved throughout the system and went to results inbox, it took me back a step. So let's try this again. So you're going to, once you have found your patient, you click referrals. And this is going to take you to the patient referral page. As you can see, there's something here loading. What is loading is the patient referral history. So as you can see, my poor test patient has been referred to a lot of doctors. So if you don't care or don't need to know any of the information about the past, you continue to go on. So you go from referral to create patient referral. In this case, the source is the provider. In a test scenario such as this, I am the provider, so I'm going to hit next. My destination is where do I want this patient to go? If I know the provider's name, I have the ability to type it here. If I know part of the name, I can type that as well. And you can see here, it pulled up anything with the words Y, the letters Y-E. If I was not familiar with a specific doctor in which I wanted to refer to, but I know the organization, I can look here. So let's say, for example, I need to send my patient to someone who can take care of diabetes. So if I need a patient to go to a diabetes center, anything with the word diabetes populates here. And as you can see, I have 4 choices. In this case, we are going to use our test doctor, which is ZZ Test. And the first thing that populates are the inbound preferences. So for example, if I'm sending my patient to this doctor, I'm going to know, okay, my patient has aloha care. And as you can see right here, that doctor does not take aloha care. If there's a waiting list, such as 6 months, then that gives you also the ability to know, okay, I can't get my patient into this doctor for 6 months. Any information that you would like for the referring doctor to have for the patient is attached here at the bottom. You're going to hit next. Reason is your medical reason in which why you're sending out this referral. So for example, if there was a chronic cough, you have the ability to put that in here. It is a free text box, so you have the ability to be as detailed as you could, please. The comments section is more on a social standard, and what I mean by that is, say for example, you have a patient that takes the bus, and in our case, let's use the island of Oahu. say they're coming from Haleiwa down to Punchbowl, you might want to let the receiving doctor know that they are traveling a great distance in order to be seen. Or if they're coming from Hilo over to see a doctor on Oahu, again, my state that your patient will be flying in. This is also good for any type of language barrier. You can request an interpreter. You can give the office a heads up, letting them know that there's things that they need. Under ICD-10, you have the ability to check by code, which a lot of your front office staff already know, or you can check by keyword. So I'm going to type the word cough, and as you can see, all the ICD-10 codes with the word cough are here. All right, under authorization information, as many of you are familiar with, such insurances require an authorization prior to the patient being seen. Such examples would be MedQuest. So if you are the PCP who is referring the provider, you have to get the authorization prior to. So here you could put authorization pending, or you could actually put in the authorization code once you received it. And again, you're going to hit next. The questions is what you might hear in the community is called the workbook. So for example, anything with the red asterisk by it is required. In most cases, most doctors have anywhere from 5 to 10 questions. And they're very routine questions. So for example, when does the patient need to be seen? What is the urgency of the consultation? And then you just go through and answer the questions as needed. I'm going to skip this one deliberately so I can show you what happens if you do not fill out the entire questionnaire as needed. And then we're going to hit next. Here you can add a file. So this is great for if you have an internal EKG that took place, if you have external documents that you need to attach, old charts, anything along those lines, you have the ability to add it here. You also can add your doctor's notes. So in the original report, you can add here. It's just like an email, so you're going to add a file and then attach whatever you need to attach. And then hit next. So the complete is just a review. Everything that is in black means that it's correct and I have filled it out. Here, as you saw, I skipped that one question that was required, so it's in red, and therefore I cannot refer this patient. If I need to go back and answer the question properly, I just use these arrows here at the top so I don't have to hit forward and back, and I can answer the question as needed. And then I can go to complete. Then review my information again, and then I'm going to refer my patient. If the referral is successful, this box will pop up that says referral for patient ZZ Test BMW was successfully sent to provider ZZ Test do not use, and then hit OK. If the referral system is from one doctor to another doctor, however, if this patient needs to go to oncology as well as let's go to a different doctor, they have the ability to create multiple referrals. And as you can see, I just sent this referral, so I'm now in the patient referrals history. We're going to go here to the top. Underneath my name is going to be referrals. And as you can see, I have a number, and that number indicates how many new referrals I've received. So if you're a specialist, this is the one thing in which you need to pay attention to, because that means that the PCP in most cases has taken the time to send you a referral, and they're waiting on a response. So as you can see, this patient was sent to me from the National Kidney Foundation. It's a ZZ Test BMW. I can click anywhere in here and I can find out the information about my patient. So for example, it says when would the patient like to be seen, on what day, was it appointment, and then if you scroll down, here is a giant text box. it's for an audit trail. So for example, if I've been trying to get a hold of the patient multiple times and they did not respond, I have the ability to make a comment. Please provide phone number. And then I'm just going to put test here just so then Melissa knows that I really don't need that. And then I'm going to hit submit. And then as you can see, here is a audit trail to go back and forth. The goal of this is to eliminate the phone calls to the offices when you need additional information. So if this patient is someone in which I want to see, I'm going to first change my status. The first thing I'm going to change is let them know it's accepted. And then yes, I'm going to accept it. What's going to happen is the referring provider gets a notification and lets them know that I have changed my status to accepted. Once I have accepted the patient, my next step is to get the patient scheduled. So I'm going to change my status from accepted to scheduled. Of course, this is after you contact the patient and get the information necessary to schedule it. So let's schedule my patient for tomorrow. And then the slider bars can be based on time, or you can type the number in here and then hit done. If the patient's been contacted, which I hope they would be in order to make a schedule, you would hit that. And then any comments. So for example, you could put in here the power of attorney will be attending with the patient, the family member will be attending, need to go over any wills or anything along those lines that's going to affect the appointment. And you're going to hit OK. It's going to let you know there was success here. So after you schedule the patient, you see the doctor sees the patient. Then this is the part for all of you that are QCIPN members. This is the part that triggers your reports. And we're going to talk about consult note added. So there's two parts that must take place in order for you to get credit if you are a QCIPN member. The first thing is the status. The status has to be changed to consult added. So that's step number one. Step number two is actually adding a consult note. So you're going to go to add a file, and you're going to pull the consult note out and hit OK. Now, how do you get a consult note to where you can just add a file? There is a step prior to that you're going to have to do. You're going to have to pull it out of your EMR and either save it as a PDF, a Word, a JPEG, whatever is necessary, and then attach it. If you don't know how to do a consult note out of your EMR, talk to your analyst, or you can call our help desk and we can help you with that. Also, so what you're going to do, if you've added the file, if there's any comments that are needed to be written, you can do so here. And we're going to hit OK. Now, one of the triggers for the report is here, where you see consult information. So you can see that the note is actually under the consult information section and not attachments. So you do not want to add a consult note under attachments because it will not trigger on a report, and therefore you will not get the credit in which you were working for. So just to kind of reiterate, for all QCIPN members, in order for you to get your credit on the reporting, your status has to change to consult added, and you physically have to go in and attach a consult note here. If you wanted to add more than one consult note, you have the ability to do so. You would just click Update Consult, add a file, and then hit Open, and then OK. If for some reason you didn't need that consult note or you added one by accident, you could just hit the X, and it'll tell you it's permanently deleted. Okay. You always have the ability to print your worksheet, but after the specialist sends the consult note back, the specialist has the ability to select complete. If you choose complete, then no further changes can be made. So you're locking yourself out of that referral. So if you forget to add consult note added, you cannot go back into it and make that change. So that's a choice you need to make. If you keep it at console added, that's fine, because that means it's gone back to the doctor, the referring provider, and the information has been exchanged successfully. One other note, if you do receive a referral, it doesn't mean that the specialist has to accept the referral. So for example, you can choose declined. And when you choose declined, you have the ability to write the reason why. So you can do patient often no-shows. Since there is a red asterisk, you do have to have a reason. In most cases, a patient will change their mind. If you want to purge this, you have the ability to do so, and it's one of the only times in which you can purge an actual referral, and then hit OK. And then it'll successfully mark as declined. Okay. You can see here my status changed to declined. Something else to keep in mind, so this is when you want notifications. I mentioned the fact that you can receive notifications when there's any changes to a referral. Just a reminder that only your POC, which is your point of contact, has this ability, or the provider themselves. You would select Options, go to Notification Settings, and then you're going to enable the notifications. You can have multiple email addresses in here, so feel free to add as many as you need. Since so many emails do come to our cell phones, we have made this customizable, so you can choose the day of the week as well as the times. So for example, that's my work email that does come to my phone, so I only want to receive notifications Monday through Friday from 8 to 5. However, I'm going to receive notifications on new referrals, status change, information change, and assigned provider change. If I didn't want all of that information, I have the ability to click and turn these off. You also can go back in at any time and make changes to this, and then hit OK. It'll tell you the settings successfully updated. So again, that's your notification. And when you receive the email, it does not contain any PHI. So this will tell you to log on and check the community health record for a referral change. The next two parts are more familiar with the terms workbooks and preferences. So for example, questionnaire management is your workbook. So that is the questions we originally filled out when we were sending the referral. This is what the receiving provider sees of what you want to be sent to you. So for example, if I want the patient's phone number, or I need the patient's blood type, or something very, very specific, I have the ability to do so. In order to add a question, your point of contact or doctor has the ability to do so. You can click on whichever type of question you would like to add. The most common is a checkbox, drop-down, or text. You're going to click on the box, and then you're just going to drag it over to wherever you want it to go. Let's say I want to put this after question 1. And then it gives you a default label. Once you click the question number 2, it turns to yellow. When it turns to yellow, that means that I have the ability to edit. So the default label is actually my question, and you have the ability to write what you see as fit. We can do please provide the patient's phone number. We can also choose to make this a required question, and then you would hit save. If you choose to add 5 or 7 questions, it doesn't matter. I always recommend you hit save after each update or each question. Because this is a web-based portal, and if there was something to go wrong with your internet, then you would lose your hard work. After you hit save, you see update is successful here in green. If I wanted to delete one of these questions and I no longer needed it, all you would do is go over to the red X and click it, and it goes away. Okay? So that's your workbook questions or your questionnaire management. The next part is your inbound preferences. And this is letting you know that's the part when I was stating you're setting the expectation for that referring provider. So for example, as the holidays approach, your office may be closed Christmas to New Year's. If that's the case, that's when you would want to notify the referring providers, hey, my office is going to be closed. This is a giant text box, so you have the ability to type anything in here you choose. I recommend for most providers to keep this updated on a monthly basis. So for example, if a doctor goes on sabbatical, if the waiting list is longer, you're changing insurances, anything along those lines, it's a great tool to communicate without having to send faxes or pick up the phone. If you're requiring new forms, this is one of the best communication tools that are out there. If you want the referring providers to have the patient with forms prior to the visit, this is where you would add a file and then have the referring documents here. After you make any change, you can hit save. All right, so what we've gone over so far is the community health records, the referrals on what to do when you receive a referral, how to change your workbook, how to change your inbound preferences, the results inbox, what you would see if there was an alert. And then the last thing I'm going to show you is my referrals, and this is just an overall summary of everything taking place with your referrals. All right, we're going to take a pause here for a moment and see if there's any additional questions. Okay, sorry to clarify, under the care team section, this was the original question that came in. It says, is the code listed next to the doctor's number the physician's NPI? No, it is not. We don't share the NPI because that would be a violation for HIPAA because that's a information PHI. Okay, so the next question is, how can you refer to a group without knowing which physician they will be seeing? Okay, I'm going to show you how to do that. So for example, I'm going to find my patient again. And I think what the question's asking is, let's say my patient needs surgery and I don't know a surgeon. So I'm going to go in to my referrals. I'm going to create my patient referral. I do the same process as I mentioned earlier. Start at the source, which is me because I'm the referring, and your destination is the part. So here, let's say, for example, I do know that I want my patient to be seen by surgical associates. So I'm going to click surgical associates and then come over here, and there's all the doctors that are currently receiving referrals through the community health record and referral module. You also have the ability, let's say that's great, I want to go to surgical associates, but I don't know any of these doctors. How am I going to know who's going to be seen? When there's larger practices such as this, a lot of them, when you go into their questions, you can put here, reason, patient wants to be seen by first available provider. That's one way you can do it. Or in questions, a lot of the workbooks will state, will the patient mind being seen by the first available? Like here, does the patient prefer the first available provider? So if you do not have an existing relationship or you're not familiar with that organization, but you know your patient needs that service, these are ways in which you can communicate that information that you may not have a relationship already, but you know that you want them to see the first available provider, so you would check that. Or you could go into the reason and communicate, I don't have a relationship, patient wants to be seen by first available. Is there any other questions at this time? I'll give you just a moment to type anything in. No? All right, so that concludes our training for today. So mahalo for joining us. But before we say goodbye, you're going to be receiving a follow-up email with a survey. Please take a moment to fill out the survey. This is going to give us information to let us know how we can better serve you and what training tools we need. We also have webinars coming up on direct secure messaging, more ways to take advantage of the community health record and electronic referrals, direct secure messaging, immunization, tumor registry, Hawaii Health Department, our PASS tool, and how to help you get reimbursed from Medicare and Medicaid through our Meaningful Use program. And remember, all the HealthyNet webinars are offered at no charge to providers and staff. Please remember to check our website for the calendar of upcoming webinars at HHIE.org. You can also find all the tips as well as a PowerPoint presentation related to today's webinar on our website. All right, if you have no additional questions, that concludes the webinar for today. Mahalo.